The health system in Nigeria is not doing good.
The state of health in this nation is unfortunate.
Every ward should have a primary health center.
Government is doing something, but nothing is happening.
I find they never pay me for my pension. How can I get money to care for myself?
We have to find mechanisms to get the resources down to the local level, better partnerships.
That spirit of treatment is no longer there.
Let's not deceive ourselves that we have enough hospitals, enough carers. We are in the bottom rank. I mean, the whole country doesn't have the number of doctors London has.
It's money, 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 money. And that is just that. Unless we understand that we're there to save lives.
Let's call on the Nigerians to help us. Come and help us, come and help us.
Ne za a burina na bisa rabbana Allah ya bar ni da lafiya na da rai da lafiya kenan kuma da abin da zan ci kenan yawa burina kenan.
Fellow Nigeria.
Here is our old river which our forefathers used. We use it in drinking.
Fellow Nigeria.
Allah ya dauro mana rashin lafiyar nan to ya zamu.
Come and help us.
Ọlọ́run ló máa ń wò wá.
Help us, Nigerians. We need a case and support.
I think currently we're not in a very good state of affairs. I can talk specifically on basic health care because that's what's affected by the MDGs, and in particular maternal health. Child health also gives us concern. And I think the fact that we're not able to deliver service to these gives us the bad indices that we have.
This country is quite interesting. Of all the countries in Africa, it's probably the only real federal republic. Others may call themselves federal republic, but we operate as a federation by far more than others.
Health is a responsibility of both the federal government, state governments, and the local government.
So it's essential that state governors, that state governments, that local government councillors get directly involved and hold themselves accountable for the performance of health in their communities.
We know where the problems are anyway. Everybody knows where the problems are.
You see, the word here we have, the words is too congested. We need to expand the words so that, like, sometimes we admit 2 people on the bed because of congestion.
Going by the parameters we use to gauge the level of health, I would say that there are areas where we are actually getting worse.
Ya zo wuni ɗaya a gida don ya koma makaranta. Sai na ji ya ce yaron kafarsa yana ciwo. Daga kafa yana ciwo ya ce kayansa yana ciwo. Ya ɗauki kayansa yana ciwo har ma ya ɗauko da wuya yana ciwo. To shine na san lalle sankarau ne. Shine na ce maza dole ne gurinmu babu mota. Babu kuma abin nan mashin. Shine na ɗauko shanuna da amalanke na sako yaron a ciki. To tafiyar mun yi ta akan awa 1.5. Na kawo shi na gudo maza dan mu zo asibiti. Muka zo asibitin Kyawa.
To akwai lokacin da zan tuna ne in ce ga inda lokacin da zan je in mori jikina lahiya lau. Ni duk lokacin da na tashi duk jikina ma ciwo ya kai saboda ba mu zama. Aiki muke ko ina, itace mu je, ɗiban ruwa mu je, ko ina da ina ma za mu je. Za mu iya zuwa ma wurin mazan mu taya su aiki. Ka gani ko?
So the level of poverty in the village is another thing. Some people can't even afford to go into hospitals.
Where is the place of health in the scheme of things in government? Health is supposed to occupy a given percentage of the budget. In fact, not less than 12% of the total budget ought to be provided for health.
If you are talking about the population of this country, the health sector and education in fact, health is the only sector in the country that everyone Nigerian out of the over 140 million Nigerians have something to do with the health. Because even if you are a healthy person today, tomorrow or next tomorrow, you will know you are state. So the state of the health of this country is very important for every one person in this country.
Gwamnati babu adalci. Dole jinya karama a yanzu a Timis ido na kwana 3 yana ciwo. Kaga maganin da na je sayan sa ta akai mun 250. Inda idan da kyakkyawan gwamnati mai adalci zan iya zuwa in beka naira 50 ko 60 ko 40 a bani maganin. Amma kaga sai da nayi sofa sai da nayi aikin kwana guda na samu kudin maganin na je kemis na sayi.
Nigeria has some of the most expensive drugs, even the ones that are off patent that are cheap. We spend up to 10, 20 times more on some very, very basic drugs, and that comes out of the pocket of the patients themselves.
Ano máa ń gbọ́ nínú rédíò náà dẹ̀ máa ń gbọ́ nínú tẹlifíṣàn tó máa sọ pé nǹkan tó bá ti jẹ́ pé health center wípé hospital ọ̀fẹ́ ni ṣùgbọ́n lọ́wọ́ yìí kò sí ọ̀fẹ́ mọ́ sí ìmí ìgbà mi ta bá lọ gan tí àárẹ̀ bá ṣe pọ̀ jù bíi 2,500 máa ń bọ́ lọ́wọ́ wa bíi 3,000 náà ó máa ń bọ́ máa ní ká lọ ra abẹ́rẹ́ ká lọ ra nǹkan báyìí ká lọ ra nǹkan báyìí owó wa dẹ̀ la máa lọ fi rà.
Government asks us to be giving drug free. That drug is free. It doesn't charge for the drugs.
Káàdì nìkan ló free bí báyìí gbogbo yòókù ẹ̀ máa rà ni.
Instead of you wasting your time, you rather go to where maybe the charge will be 2,000 or 3,000 difference, and you just pay off and go.
Yes, and people pay for it too. Not as if you go there and get drug. Who will give you drug free?
Money leaks from the system. If you want to call it corruption, if you want to call it theft, it's all well and good. But until we face that particular issue and make sure that when money is applied somewhere, it actually gets spent, we need to put systems in place to address that. If we don't, then things will always cost us more.
And I'm not a rich man, I'm very poor. I have no power of money to get to the hospital.
There is no free lunch in Freetown. I don't think it's possible to give something free to everybody. Even when you say it's free, somebody has to pay for it.
What they did to me that night, it happened around 8 o'clock in the night. And we left here around 12 in the night to a private hospital. I was bleeding, seriously, and they refused to give me treatment. Until when I called my people, they came that night and took me out of this place.
It is not the health worker alone, it is a Nigerian problem. We do not take service and as a delivery of service as something which is serious. You go into a hospital, or you go into a shop, or you go into a school, and the kind of reception you get and the kind of attitude you get is almost like they're doing you a favor.
The fact is this: the maltreatment, as in they're maltreating people, as in they make people as if they are not human beings. A patient will be sitting down, nobody to attend to, and for some hours, you yourself that you are coming, that you are a little bit elder than him. How are you going to face it when you know that, look at this one, that his situation is more worse than your own?
I think it's worse in health because a patient who comes to a hospital, or even somebody who is just trying to find information, is anxious about what he's trying to find out. He's not there to play. He or she wants information or service.
Most of these people suna cikin wajen ƙauyuka haka, wajen hard to reach areas, wanda suna ganin su fito yana musu wahala. Ka gane? Kuma akwai wani a kind of bias abu da suka dauka wa asibiti cewa idan suka zo kila ba zai musu daɗi ba or something like that.
That is something which we have to work on considerably if we are going to make any difference.
You know, you can't differentiate between a doctor and a student doctor.
Generally speaking, the medical schools are being left behind in terms of modern medical technology.
My name is Abdulafiz Uluwa and I am a 400 level medical student.
But as a result, our training is much more hands-on. The clinical skills that our young doctors have is far superior to the clinical skills of the doctors trained abroad.
The lectures are good. They could be better, but they are good. The environment could be better, but it's also good.
Today you will go to specialist and see this doctor. Tomorrow you can go to that specialist, you see another doctor. Next tomorrow you go, you see another doctor entirely. And the way this one will attempt you is not the same way that one will attempt you. Forget about that, there are some things they write there in the card or whatsoever nonsense they call off.
A lot of the medical schools are overcrowded. The numbers of students that they're taking is far in excess of the facilities available, both in terms of the teachers and the physical facilities.
I'm a doctor at Lagos University Teaching Hospital. I graduated 2007.
Doctors constitute the biggest amount of people who are leaving the country. It's almost like when you're graduating, the next step is which country am I going to move to?
Number one, you're not appreciated here. Number two, it's damn too difficult doing what we do, the way we do it every day and expect to live long.
The doctors are well grounded. They can teach their international standard, I have to say, but the environment in which they have to compromise a lot of things because the environment is not conducive at all.
I know people that have gone to Saudi Arabia, the US, Australia, South Africa. I even have a friend in Equatorial Guinea.
This one will just prescribe his own differently and talk that differently. That one will just prescribe his own. You know, there should be a specialist, a person well trained because you are dealing with life.
Right now I'm thinking if I just can't have it anymore, I don't mind out going into banking.
There has been wide appreciation of the need for much more in the way of resources at the federal, state, and local level. Nigeria is already investing a significant amount at the federal level, but there are issues in terms of the efficiency of resources, the use of those resources, whether or not they're really being invested in the way to best make an impact on the health of really the neediest Nigerians. And when we talk about that, we're really talking about primary health care.
Lots of cases that you see in the tertiary hospitals would not need to come to the tertiary hospitals if the primary healthcare centers were well developed.
The whole essence of primary health care is bringing care to the individual as close as possible to his home.
One of the problems I see is that primary health care falls under the responsibility of local governments.
The ward should be the socio-economic unit of Nigeria, just as it's the political unit. When you do that, you can actually easily see what the politicians are doing in their ward, not coming every 4 years to kill a cow, bribe for elections, and then go to the next stage. But if you know you have a primary health center there, when he comes for the election, you can ask him, what my primary health center has no tablets, no this, no drug, no doctor, no that.
Here we are in a
PHC Angwan, Sanusi Primary Healthcare. As you can see, the whole place is empty.
The state government are responsible for the leadership at the state level for the healthcare and also the provision of secondary tier of health. The local government at that level is supposed to have been fully responsible for primary healthcare facilities and health of the people.
We are in one of the consultation rooms. Actually, the doctor is not here because the primary healthcare have no doctors, but we have all called the officer in charge.
Doctor name is native doctor. One cure and oríṣiríṣi àrùn.
There is a Yoruba proverb that says something like this: before the arrival of corn, the chicken used to eat something.
I caused by accident. I fell on my shin and broke leg. I went to my doctor now. We have native man who are making this bone problem. If you break your bone, he will make it so that you will be normal and they walk as he walked before.
You said it's yellow fever. That is the thing. And the parents are not, so they are not literate anyway. So, and they believe so much in these herbs. And the resulted are saying the herbs should be taken first, and you don't take herbs as in orthodox medicine together with modern medicine. So that was happened. So they were, all this while the boy was taking placed on herbs, and the whole thing continued getting worse until after 2 weeks, the boy now gave up as a result of that, and that's the end of the whole thing. So he was buried yesterday, the boy of 18 years.
They are they're passing a lot of misinformation to people. You know, look at the staphylococcus fair. You know, about 8-9 years ago, somebody just figured out that staphylococcus is an exotic sounding name, and then, you know, it's the cause for STDs, is the cause for weakness in the body, is the cause. And then there was a deliberate attempt to push out this information, and people were buying it.
Inda ka samu mai magani mai kyau wanda ya baka, ya buka je asibitin kai ta bin layi, saboda maganin gargajiyan kana zuwa insha Allah kana amfani da shi zaka samu sauki.
Traditional medicine is here, it's not going to go anywhere. But the issue is, what are you taking, what doses are you taking, and is that the right thing for you? What has also happened is that pastors and imams have set up clinics. They call themselves missions. And in those places, they say, God is going to deliver you.
It's because of this thing that happens to me now, that causes. If I do hard working, it's going to be disturbing me.
Sometimes you find that clerics become a stumbling block in the path of health, because you find a cleric talking about something that he doesn't know.
I'm not taking medicine, because I'm sure I don't need to take it. No prayer now.
Hospitals are for delivery. Missions and pastors and imams are for deliverance. They're two different things.
But I don't blame them, because they don't know. When you go to scholars or clerics, you talk about maternal mortality, they don't know what it is. When you talk about folio immunization, they say, no, that is family planning, that is this and that. So they don't know. So we need to enlighten them.
Push out this information.
To sensitize them.
Television.
We need to educate them. We need to show them that this, what we are talking about.
Media.
1 million posters of this same information in every classroom. The children will go home with that information. They become educators.
Whatever you do in Abuja or in Center may not percolate to the states.
As we are going on advocacy, you meet the village head and you tell them or him why you are there.
You better traditional leadership, I'm using very broad sense now, discuss with them and convince them. If leadership is not convinced, his level of conviction is the level of participation of his community.
The challenge now is how do we ensure that all our people will put aside cynicism and believe in this country, because it's the only one they've got. This is the only place where first-class citizens. Everywhere else, second.
Go out there and reach my children. Go to the streets and rescue them out of the streets.
In line with the MDG programs, women, children are owed an obligation because they are vulnerable.
Father Lord, we thank you. We pray that though she was picked on the street, Auntie Tony is somebody that read abroad. She casted news in NTA 10.
Lagos State Broadcasting Corporation, Ogun State Broadcasting Corporation, NTA 7 and NTA 5.
And she also participated in Adio Family and Village Headmaster TV programs. This auntie here, this is where she was lying at Boma Road. Papa, see my national coordinator trying to lift her up.
What I believe we need to do, educate people a lot more.
It takes little thing to cross over to the other side as a human being, me and you.
There are very few people who really want to be seen or associated with a psychiatrist.
Stigma is certainly a very important issue in mental health. But what people don't realize is that the people that you call nutcases, these are the very, very seriously ill people, are just a minority of mental health problems. Most mental health problems that we see are, involve emotional disorders which are relatively easy to treat.
There's a major cost that we've paid and we continue to pay for not paying attention to mental health and mental health issues.
If
you ask any prison officers, they will tell you that they have a great challenge in their hand in terms of health.
Overall, I would say the inmates are in generally good health.
Place like Nsukka prison, which does not have a general hospital, have a dilemma of looking for where to take them to. More importantly is for the women. You know, sometimes these women get pregnant in prisons. Some of their children grow up in the prisons. How do they have enough Medicare for those children?
First, I was sick, and we went to the hospital. They tested me. I became HIV positive. Nobody comes to my bed anymore. I was just there, and they were like saying, if they don't take time, they will come and inject chloroquine into my drip so that I'll die.
They have blood and water. They also have. There should be no discrimination. There should be no discrimination of any sort at all.
Evan B. Ijom Ishog. I gave a milk. I agree, Mamma. Madessa. I will let you cook whatever we have in a second.
Ocho ye gaduma, ele ada, yogaduma, ele. Ocho ye gaduma.
Nigerians, Northeast, West and South. Let's come together as one.
After how many years of independence, where we dey go, sef we never know. And our